Glucosamine sulfate. I love this stuff. I was using glucosamine sulfate back in the 90s. The studies were mostly in Europe, and they showed better range of motion with people who had joint problems, arthritis. The glucosamine sulfate, most of the studies are with chondroitin. It's great for joint problems. If you have muscle aches, it won't really do anything for you. But if you have like my rotator cuff won't get any help from glucosamine sulfate. But if my rotator cuff is healing or my shoulder's going through more range issues, if the joint itself is getting impacted hard, that's where glucosamine sulfate will come in handy. If you have a gouty issue, if you have a fracture, probably won't help the fracture unless there's an issue with your heel or your knee. But 1,500 milligrams a day, very good. The only problem with glucosamine sulfate for arthritis and or joint pain is that it can cause an upset stomach just like Advil. So you have to be careful, you take it with food, and again, you have to know which brands you get. Glucosamine sulfate by itself isn't, the studies don't show as good an absorption or range of motion as with glucosamine sulfate and chondroitin sulfate. And you'll find this with a lot of it on the shelf will be with MSM or ASU. It doesn't, those two suffixes don't really matter. It's glucosamine sulfate, 1,500 milligrams a day, that's important. Just take it with food. Bromelain, boswellia, both nice anti-inflammatories. Haven't been studied, but they're usually secondary products when you buy something that's like IF relief or an inflammation inflammatory. They'll have those two things in addition. White willow bark is where aspirin came from, a natural anti-inflammatory. American Indians use this. They grind it up and they put it into a poultice or a tea. For muscle spasm, I like using passion flower, lemon balm, and valerian. You can usually find those three in teas. It calms down again. Again, we talked about calming down. Anytime you have an injury, say I'll go back again to the fracture. When you have a fracture to one, I'll use the humerus. If there's a fracture to the humerus or to the foot, the muscles around the fracture will be spasming up to protect the joint. The muscles will spasm up. It's normal. Sometimes you want to get rid of the muscle because, again, it's a second problem. You have the fracture pain to deal with and then the muscle spasm to deal with. Then you have the joint problem we talked about earlier to deal with. So passion flower, valerian, and lemon balm all relax. If you have any child that's hyperactive, I think this is a great thing too. But very good for muscle spasm. Kava kava is really good for muscle spasm, but you can't use kava kava because there have been reports of liver toxicity and liver failure with using more than a month's worth. So I usually will use kava kava if I have somebody has injury and anxiety altogether. The other parts or things you can do to keep the milieu, keep the pH high instead of acidic, are counseling. I think counseling is great for most Americans. Most Americans are high stress. And because,
really?
well, because of that, you know, only, and I keep on commenting about this, in America, PTO is always cashed out. We always look for PTO to be cashed out. In France, PTO, you have to take advantage of PTO and time off. Relaxation is really important. We kind of postpone that and try to get as much out here. Well, not everybody, but I think that relaxation is really missed in the United States, and that can lead to high blood pressure, peptic ulcer disease, insomnia, anxiety, and that's the majority of what we see in the emergency room. Relaxation response, not too many of us practice it. Some of us with Tai Chi or yoga practice will do the relaxation response or bring it out. Meditation, prayer, breath work, our nature preserves. Or I'm a yoga instructor. I think yoga is very important because not only the flexibility to prevent an injury, but also the breath work and the slowing down that's required in yoga that usually people leave the class with great benefit. Even my mixed martial artists, this is Felice Herrig. She's a Bellator fighter. She's a professional fighter. Even my MMA professional fighters will, you would think they always want to go adrenaline, testosterone, but the best ones will learn how to calm and slow down. Here I was kind of just relaxing her because of something else, but I have a acupuncture point in her hand, in the ear, and then in the third eye. And then I usually will go through breathing exercises. But that will calm even the most aggressive people down so that they can perform better. Again, if you cool the milieu down, your body can fix faster. The fibroblast will know exactly where to go instead of going everywhere. Those of you who, let's take a fractured foot, for example. If you have arthritis, not you, but if you have arthritis, if you have an old rheumatoid problem or an old gout problem, and then you fracture, guess what happens with the gout and the arthritis problem? It gets turned on. Because those fibroblasts I showed you earlier, they won't just go to the ankle, they'll go everywhere that was previously irritated. If you had a tight hamstring or a tight quad and a little bit of kneecap pain when you're bowling, or a thumb injury when you're bowling, it will become loud when you're trying to heal up the ankle. That's why it's important to bring it down fast.